Hello, everybody. Welcome back to another episode of the Rehab with Roni podcast. I'm sitting here today, and it's the perfect podcasting afternoon. It's a Sunday afternoon, and it's raining outside. It's stormy, but it's spring, so everything's blooming. And I'm sitting here at my desk looking out the window, just ready to chat, ready to really deliver some good content for everybody listening. It's just moody right now, and this is one of the first podcasts where I've taken notes prior to. A lot of times I'm just sort of winging it, but this was a highly requested topic, and therefore I felt like I wanted to be a little bit more organized before I just started chatting. Today's episode is all about imposter syndrome, and this is a question that comes in a lot, I would say more frequently than I would like because it makes me sad that so many people are feeling this way. But I would be lying if I said I hadn't also experienced that to some degree as a new grad, trying to work as a physical therapist out in the real world, and then also as a new business owner. So I want to touch on both sides of it. And first, I want to start with the definition. Imposter syndrome is a psychological phenomenon characterized by persistent self doubt and a feeling of being a fraud, despite evidence of one's accomplishments. I can't say that I ever felt like a fraud when I was working as a physical therapist, but I do remember feeling almost like I was pretending to be more qualified than I was, despite the fact that I knew I had done the 4 years of undergraduate work and done the 3 years of physical therapy school and had the clinical rotations and had interviewed for the job and gotten the job. I just still didn't feel confident in my clinical skills. And that was where I started to feel like an imposter. And I think that's super normal for a lot of people, whether you're a physical therapist or not. I don't even think it really matters what you do as a career. I think when you graduate college, you've spent a lot of time doing a lot of learning. Some of those things may be applicable to what you end up doing to make a living, but a lot of those things aren't. And therefore, you're thrown into a job oftentimes where you just don't feel like you have what it takes and you're kind of pretending along the way. In the early days in PT school and right out of PT school, I would always just say, oh, fake it till you make it, fake it till you make it. And there is some truth to that. But I want to talk a little bit about imposter syndrome and dealing with it as a new grad. So, as a new grad, here's the thing that I think plays into most people's insecurities. And this is just based off of my assumptions. And not everybody is the same age going into PT school. Some people wait a while and then go back. But most people graduating from PT school are maybe 24 years old. And while that might seem old to somebody who's a teenager, to a large majority of the patients that you're treating in an outpatient setting or an inpatient setting or hospital setting, that's really young. And there is something to be said about being the youngest person in the room sometimes. And it's age isn't everything. It is just a number, but I remember feeling a little self-conscious of my age. Like here I am trying to deliver some medical advice, complete a thorough PT exam and then tell this older individual what to do. And who am I to say that? I'm as old as their grandkids. Like, why would they listen to me? And so I think the age portion is just by nature something that tends to play into the feeling of being an imposter. And to that, I would say nobody needs to know how old you are. I never lied about my age, but I would avoid it at all costs when people would ask. And oftentimes patients aren't going to ask, but you get the occasional, how old even are you? And oh, well, I'm 25 or I'm 24. And they sort of make jokes about it. And it's never as big of a deal as you think it is. But I would just say if you can avoid that conversation, that's helpful because it does create a little bit of a barrier. And there's really nothing you can do about it except continue to age at the same speed that everybody else is. So it's an unfortunate piece of it, but try not to talk about it. And if people are asking how old you are and maybe seeming like they're a little distrusting because of your age, I would always mention how long I went to school for PT school and then also oh, these days they actually require that you get a doctorate. Just for people that care about those things, it can be helpful. I also remember in my first probably 6 months of working in an outpatient setting, just not feeling confident in my clinical decision making, diagnoses, exercise selection naturally. I mean, you go through 2, 3, sometimes 4 clinical rotations depending on your school, but a lot of times you have a lot of oversight with your clinical director, and there's always somebody that you can reach out to in that setting as a student to double check and make sure that you're doing things right, and does my train of thought make sense, and do you think that I made the right decision for this person? And then when you're suddenly by yourself, it's daunting and it's easy to doubt everything that you've learned, and your brain just gets jumbled, You're like, "I know all of these things, but how am I supposed to organize them into a cohesive thought and create a plan of care that makes sense for this person? I don't know what I'm doing." And honestly, I think I was fortunate to have a mentorship program in the job that I had, and I would highly recommend for those of you that feel that same angst and worry about just doing the right thing and being smart, seek out a mentor if that's not something that your company provides. I was lucky enough to have the program set in place, so I met with my mentor, I think once a month. I would go to her clinic, shadow her, and we would talk through difficult cases, and then every 2 weeks, there was a new grad, I guess, discussion group where we would go to one clinic and everybody would be there, and we would talk through different cases. We would go over different body parts and treatment methods. It was great. It was so helpful because I felt like I had a support system and I didn't have to seek that out. I'm sure other companies do that, but if not, think of somebody that you know that's been in the profession for a little bit longer than you and see if you can make it a regular habit to just chat with them and talk over difficult cases, because you will have cases that seem pretty straightforward, and then you'll just get a zebra one day and be like, "I don't know what's going on with this person. Please help." I remember one of my patients, she had long COVID. That was her diagnosis, and she had the most insane neural symptoms, sensory symptoms, weird responses to exercises, high anxiety person, and there was a lot more going on than just her physical symptoms, and so I definitely employed the help of my mentor to help me figure out, how am I supposed to deal with this person 2 times a week for the next 6 weeks or for however long she came, and she ended up getting a lot better. I don't know how much of that was me, but I was able to get through it because I had somebody to chat with about it. And on top of that, if you don't feel like reaching out to somebody and having a set date and time to always meet with, just talk to your clinic director, talk to your coworkers. Don't suffer in silence, because I had a great clinic director who had been out practicing for probably 9, 10 years at that point, and he was always doing great stuff, and he was smart, and any questions that I had, we would do a weekly meeting just about the clinic, but then I would always bring up people that I wasn't sure about or that I maybe just needed an extra set of eyes on, and I guess there's a little bit of, I guess you'd call it humility in that. Have humility. Being able to ask questions about patients and not be right all the time and not be too prideful is important. Like, don't let your pride get in the way. There were multiple times where the clinic director was with other patients and I was in the middle of an eval and I wasn't sure if this person had torn their meniscus, or I just wanted to double check and make sure that their leg wasn't too warm, or they weren't, maybe this was an infection, just whatever it is. If they have the time and they are a nice coworker and want to see you succeed, ask for help and ask for a second set of eyes, because you're going to learn through that experience, and you'll build trust with your coworkers and with your patients, because the patients want to make sure that everything's okay too. And I think the patient is going to have more trust in you if they see that, okay, Ronnie's not entirely sure what's going on. She wants to double check with her elder. This guy's got 10 years of experience on her. Like, let's all get together and we'll be a team. We'll work on this as a team. And I touched on this previously, but I'll say it again. I think being honest with your patients is really important, because I think a lot of people in PT school are type A, perfectionists. Everything must be done correctly to the T. We make no mistakes. You know what I mean? And telling your patients up front if you don't exactly know what's going on, but informing them on what your plan is and how you're going to reassess every time and just aim to be moving in the right direction, keeping them informed on what your plan is and maybe not trying to seem like you know everything, but saying, "This is what I think is going on. This is my plan to help you get better. We're going to continue checking as we go. If it doesn't seem to be working, then we'll switch gears or we'll send you back to your doctor." Communicate with them, and communication is key. And they will respect you for it if they see that you're trying your best and maybe they know you're newer, but they know that you're doing your darndest to get them to where they need to be. Now, you don't have to be like, I have no idea what's going on with you. Like, let's just try some straight leg raises to get those quads going. And who knows? We'll see. Do it in a professional manner. But yeah, be authentic. Don't be pretending like you know everything that's going on if you really don't. And then go home and do your research. And when you go and see them for the follow up visit, be armed, locked and loaded, ready to go with new things to try and new research to fuel your fire. Lastly, my last little piece on the imposter syndrome with being a new grad and being out there in the workforce as a fresh young buck is to take time. And that's very frustrating because time is going to pass at the same rate no matter what. You can't speed it up and all of a sudden feel better. But suddenly 3 months will be past and you will be over that initial freak out period. 3 to 6 months. I mean, some people might take a little bit longer. Maybe it takes you a year, hopefully not. But with higher volume of treating patients and with more experience and the more you're exposed to things, naturally, like anything else in life, you're going to get better at it and you'll start to feel more confident and you won't overthink things so much. After, I would say probably 6 months, I felt pretty ingrained in the workforce. I felt like I knew what I was doing, pretty confident. The questions at our weekly meetings with my clinic director got fewer and fewer in terms of questions that I had about patients and what the heck to do with them. And by the time I left that full-time job about 2 years later, I was rocking and rolling. I felt pretty good about everything. And again, lifelong learner, I definitely didn't know everything, but I felt really confident in my ability to treat 99% of my patients. And then when I had questions, I was super quick to ask. So, what I did not anticipate was this newfound imposter syndrome when I started my own business. If you go back and listen to the episode about how I got started, it all kind of happened really fast. And initially, my plan was to work at the corporate PT job and also do the thing with the gym on the side. The gym thing started in January of last year, and I was hoping to continue doing that until August, September. And as it built up, maybe pull back on my hours at the corporate PT job. So, in no way, shape, or form did I think I would be fully on my own on April 1st last year. The process got expedited because corporate PT didn't want me doing both, and that's fine. But with that came this very strong, very sudden sense of imposter syndrome on a totally different level. It's one thing to get up every day and go to your job and only really have to worry about the patients in front of you. And it's another beast to get up and go to work every day, but you're alone and the patients are only going to be seen if you go out there and find them or they find you. And the business is your name and everything that happens that day is whether or not you made it happen. No one's doing anything for you. There's no marketing team, there's no documentation team, there's no nothing. It is full-fledged just a one-woman show. And while that was honestly so exciting and I think I was ready for it, part of me was ready for it anyways, it was also very daunting. And I'm definitely not I wouldn't say I'm a really self-conscious person or a very self-doubting person, but in those early moments, I found myself a little concerned that I just didn't have what it takes. I was just like, "What am I doing? How have I gotten myself to this place, and how the heck am I gonna keep this going?" I'm a physical therapist. I didn't get my MBA. I'm not a business owner. I'm not a business lady. I just treat patients most days from 8 to 5 or 8 to 6 p.m. There's I literally don't know what I'm doing. It's funny to look back on now because I feel so different. I feel like myself again. But back then, I did have this sort of underlying constant sense of unease. And it was almost like everything was up in the air and it could all change at any moment, which was honestly true. But I think about a month or 2 into it, I had this realization. There was this constant loop in my head where I kept telling myself, "Why would anybody come to you versus all the other physical therapists in town? I mean, you don't do anything special." I know, really negative self-talk, guys. Don't do this. But I couldn't picture why people would choose my services, and if they did, how I would ever care for them. And then it hit me one day. I was like, "Wait a second, Ronnie, girl, you have been a PT for" at this point, it had been over 2 years. You've treated hundreds of patients, and you did all of that in a setting where you had to divide your attention amongst 2 to 3 people at a time. Now, you have found yourself in a situation where you can devote your undivided attention to the one person in front of you, and that is such an accomplishment. Basically, I just needed a little paradigm shift. Like, okay, you you think that you can't do this? Well, you just did it for 2 years with 17 patients on your schedule. Now you have 3 people on your schedule, so do a really good freaking job, and they will tell their friends, and they will tell their families, and it's gonna be fine. You have the skill set, you just don't have the confidence as a business owner yet, and I had to make that distinction. So I told you guys I've written some notes. I wrote 2 types of imposter syndrome. First type, as a clinician. Second type, as a business owner. I said, I think a lot of times when people get imposter syndrome in terms of business ownership, it's more so from the fear of failing and less so about not being capable and up to the task at hand. Basically, what I was trying to say is I was confident in my clinical skill set and I knew that people could get better. But what about all the other stuff? What about the part where I work for myself now and I literally don't have a paycheck coming every 2 weeks and I don't have health insurance? It's just a whole different system of issues to tackle when it's not just patient care. It's marketing, it's advertising, it's branding, it's getting out there and remaining confident in the face of adversity, you know? So, as I mentioned, the first thing that helped me in the very beginning was realizing calm the heck down. You've treated patients 100 times before. These patients are no different other than the fact that now you have more time with them and therefore you'll maybe even be able to get them better faster, depending on what's going on. Then I just had to get over the fear of failing part. I just had this sense in my head and in my heart, that that it wasn't gonna fail because I didn't have any choice in the matter. It was like, okay, either you go back to the job that you really wanted to get out of, or you have to make this thing work. There's no other option, really. So I think going into it knowing that your options are limited, if you were in a similar boat where maybe you're thinking about doing something similar and you are super not happy with the current job situation you have, make it make it an ultimatum. Like it's either this or I start my own business and that's it. I remember I heard this quote one time and I'm going to botch it, but it basically says the mediocre and tolerable job is the killer of dreams. And I think about that often because if you're in a job where you're content, you're liking it, but maybe you're not loving it. Maybe you're not even really liking it, but it pays the bills. You got good health insurance. It's not too long of a commute. You get 2 or 3 weeks of paid vacation and you can tolerate it. You'll stay in that job and in that field forever without ever really considering what it would be like to do something different. So the mediocre job is the killer of dreams because I didn't I promise you guys I didn't hate my job, but I wouldn't say my feelings about it were mediocre either. I pictured myself there 10 years from then, like working in the same job, and it filled me with a sense of fury. I was like, I literally cannot do that. And that is, I mean, that was the straw that broke the camel's back, and the camel was me. I was like, I knew I had to get out of there. And I think that's a pretty applicable quote. The job itself was good and the work was good, but my feelings towards being in the same setting and doing the same thing in 10 years filled me with a sense of fury. It was a catalyst to make me jump off the ledge and dive headfirst into trying my own thing. And so consider that. If you're in a job where listen to me giving business advice. This is kind of has nothing to do with imposter syndrome, but it kind of does. If you're in a job where you really kind of hate it and you don't know where you're going to be in 5 years, but you hope to God it's not there, then I don't know. Maybe it's time to consider doing your own thing because I certainly do not regret it. So, mediocre job, killer of dreams. Anyways, I had to also get over a little bit of the fear of people, I don't want to say judging me because everyone's going to judge everything. You can't help it. I think it's human nature. But I was very public about everything that was happening on Instagram. And a lot of people that I knew in the PT world followed me, and friends and family members, and a lot of people were really happy for me. But I also knew probably there were some people that didn't love what I was doing for whatever reason. And to that, I will say, who cares? At the end of the day, they are not going to be the ones that are directly affected by your business venture, right? You are. And your spouse or your partner or your family or whoever, your friends, they're going to be the ones that benefit from all the hard work that you put into it. So knowing that sort of empowered me to not give a shit what I put out on the internet and to keep doing the things that I was doing. And so far, it's been pretty fruitful. Last thing I'll say, last thing I want to touch on in terms of feeling like an imposter in your own business and in the business world is I think it's crucial to remind yourself that nobody really cares what you're doing. No one cares except your immediate friends and family. And everybody else is very focused on what they're doing. And that is empowering, I think, because if you don't feel legitimate or you don't feel like you're established enough or smart enough, no one's going to take notice. Unless you are an absolute failure, you're going to be fine. You're smart, you've made it this far, and therefore you have the qualifications to do whatever it takes to get where you're going. I think a lot of people can get into this over analysis paralysis where they have to have everything set in place and everything set in stone before they make that jump. And I will be the first to tell you that that is not how it went for me. That's not how it goes for a lot of people. And a lot of the figuring it out just comes as the experience comes. You just got to wake up every day and grind and not worry that everything isn't perfect yet. While I'm still trying to always be a lifelong learner in the PT world, that also applies to business ownership world. There's so many things I don't know. The amount of things that I don't know and my awareness of the fact that I don't know them just grows by the day. I wake up and I'm like, I know nothing. I don't even know where to start. So get comfortable with the fact that you don't know anything and you are just going to continue to learn and continue to grow. And I feel like I'm giving myself a pep talk because I need to hear this too. But yeah, I hope this was a little nice little present for you guys, wrapped neatly in a little bow on the different struggles, the trials and tribulations of imposter syndrome. It is so common. And like I mentioned, it makes me a little bummed to see how many people are struggling with it in physical therapy school. But I'd be willing to bet that med students, brain surgeons, heart surgeons, chiropractors, people working on Wall Street, people working their first day as an electrician, everybody's feeling it to some degree. And so just remember that nobody cares as much as you and nobody's watching you. That's my closing statement. No, but really, I hope this was helpful. I think I wish I had something similar to this podcast when I was first starting out as a physical therapist, but time is everything and you will get wiser as you get older. And I really appreciate you guys for listening to this episode. It makes me happy, and I shall see you next week.